Welcome to my talk at SCONA 2023, and thanks for joining me today. My name is Bill Hunter, and my talk today deals with an experimental investigation into the delivery of powders into the nasal airway. This is required as a means of validating CFD results for the delivery of nasal powders. Firstly, a little bit of background about me. I'm a newcomer to this field in an academic sense, as I've started my PhD in this area of research a little over 12 months ago. My thesis is around the optimization of intranasal drug delivery devices, primarily for drugs in powder format. However, I've been engaged in this field of designing medical devices and diagnostics in contract R&D sense for more than 35 years. And that includes working on intranasal spray devices for migraine treatment going back to 1993. And you can find some of my previous experience and relevant pharmaceutical industry clients here on this slide. So the starting point of my thesis was to consider whether atomizing liquid sprays were the best way of delivering drugs to the nose. And the way in which these sprays work is that liquid is delivered from a pump at pressure into a swirl chamber, and so the liquid spins around in the swirl chamber until it exits an orifice where it comes out with a swirl component as an axial component. These types of nozzles have been around for a long time. They've been used for fuel injectors and aerosol spray cans, and they're still the most widely used method for aqueous nasal sprays. They produce some spray characteristics though which really don't suit the tortuous path of the nasal airway. And so why would you want to deliver drugs higher and deeper into the nose? Well, this won't be news of course to most of you, but for starters that's where the olfactory region of the nose is, and it's the olfactory region of the nose where the olfactory nerve comes down to meet the nasal airways, and that olfactory nerve potentially allows direct transfer of drugs from the nose to the brain while bypassing the blood-brain barrier. And turns out that location might also be important for vaccines because the olfactory bulb is rich in ACE2 receptors, which have been noted, for instance, as key receptors for the SARS-CoV-2 virus. So clearly there's been a lot of previous work on developing devices for delivering drugs higher and deeper into the nose, specifically with the idea of being able to achieve nose-to-brain drug transfer. But in spite of all that previous development work, to the best of my knowledge, there are only 2 FDA-approved devices on the market which claim to be able to deliver drugs higher and deeper into the nose. And interestingly, the FDA notes that neither of these products actually indicates that they, on the product label, that they perform olfactory targeting, and it's not in fact clear whether these products are delivering drugs via the nose to brain route or systemically via the small blood vessels in the nasal airway. So overall, nasal sprays are a big business. The global market in 2023 was estimated to be around US $34 billion per year, and most of that's liquid nasal sprays. But in regards to whether you might want to use powder or liquid for intranasal drug delivery, even though most of the sprays out there are liquids, it's worth considering powders as well, which have some benefits over liquids, which I go into here in this table. And so just quickly, in terms of drug dose, powder delivery devices allow a microgram to milligram drug dose to be delivered, whereas liquids generally only micrograms are possible. Powders can have a longer shelf life, they're more stable. Powder delivery devices in the literature do have a higher olfactory deposition efficiency. Some of the literature cites more than 40% versus 1.6% typically or thereabouts for liquid sprays. With a powder-based spray, you don't have the problem of liquid potentially dripping back down into the liquid container and causing microbial growth, so that's not a problem. Powders don't require cold chain storage and transport, which of course has been a problem with SARS-CoV-2 vaccines. We can have a longer nasal residence time potentially with powders by tailoring the excipients to do that. And powders can achieve much narrower plume angles, and also via powder formulation, smaller particle sizes generally too, excluding nebulizers of course. I'm just talking about conventional sprays here. So that means that it's possible to achieve lower particle momentums using powders compared to liquids. So when I started looking into powders, thinking that might be an attractive idea, I looked to see whether I could find some previous research on CFD simulations of powder delivery to the nose, and I couldn't find any, but if I've missed some in my literature search that any of you know about, I'd be grateful if you could let me know by email. But obviously there's been a lot of previous papers published on CFD using liquid nasal sprays, and lots of papers also describing the use of CFD for dry powder inhalers for pulmonary inhalation therapy. So it should be possible. There's no reason why we shouldn't be able to perform CFD simulation on powder delivery in the nasal airway. Now, in terms of if we're going to do CFD on powders in the nose, we would also want to be able to ideally validate those results. And the method used by Kundor and Dalby in 2010 using Sargel, a water indicating paste for liquid nasal sprays, was very interesting. They used a water clear Kochen cast to show the spray turning the Sargel from clear to purple, which pretty much shows well where the spray is ending up. And this clear Kochen cast has some benefits, being that it's commercially available, it's water clear, which enables excellent imaging capability, and it's made from an inert material, which is silicon, which doesn't stain and easily washes out in tap water. But the problem is, when you try to use that cast for powders, it's difficult to see where the powder is actually going, because typically you have white powder and white lighting, and that doesn't give you a good image to look at, as this example here shows from Colombo et al. In 2016. So a Sargel type method would be helpful for powder visualization and deposition measurement. So we made a fluorescent powder, and I won't go into the details of this, but we added some fluorescein to a lactose powder and made a customized powder dispenser using a controllable air jet, and we dispensed this powder, this fluorescent powder, onto firstly acrylic plates coated with mucus, and then secondly into the Kochen cast, which we procured, which was coated with artificial mucus. And then we imaged this fluorescent particle, which dissolved into the artificial mucus within the cast under UV light. And so here's some images of the powder being deposited onto flat plates, and you can see that the intensity of the fluorescence of the fluorophore changes in a manner which you would expect as the mass of powder delivered by the device changes. And in fact, when we plot the fluorescent intensity versus mass, we get, on a log-log basis, we get a straight line plot, which is as we would expect to see if we had liquid fluorescein in a well and we measured its fluorescence versus concentration. And so then next step was to see how this powder performs in the nasal airway with the Kochen cast, and here is an image on the left which shows the raw image of the fluorophore deposited in the Kochen cast, imaged under UV light, and then on the right taking that image into an image processing program, image J. You can see there's actually quite a substantial powder deposition in the upper posterior part of the nose, and actually quite a lot of powder being delivered there in the olfactory region, which would be suitable for nose to brain drug transfer, so that's good. Also we can see a little bit of powder though in the pharynx, which we don't want to see because those are small particles potentially going down into the lungs. And then when we run a CFD simulation, of a simple CFD simulation of the powder deposition, we can also see that the predicted ANSYS fluent powder accretion in the upper posterior part of the nasal airway actually looks quite similar to the experimental powder deposition that we saw from that last experiment. This is based on a model derived which we made from a CT scan of the Koken cast. And in fact, you can also see here that we're getting upper posterior powder deposition measured on an area basis of around 38%, which is a good number in terms of upper airway deposition. So from there, we've now gone on to develop a monomodal powder, which basically blends the fluorescein into the particle itself, which has a narrower DV10 to DV90 spread. And the next steps are that we will be analysing that. So in conclusion, this method has shown good similarity between CFD predicted powder deposition and experimentally observed deposition, and fluorescent imaging in a water clear cast provides useful guidance to the amount and location of powder deposition in the nose. And we're seeing around a 20 times increase in deposition to the olfactory region compared to liquid nasal sprays. We'll be trying out this monomodal particle, but this method shows that CFD plus fluorescent imaging could optimize powder device and powder blend for nose to brain drug transfer. So here are all my references. Thank you very much to Kiao Inthavong and David Morton, my other supervisors, Sarah Haji and Svetlana Stevanovic, for helping me with all this. And I'm grateful for your listening to me today. Thank you.